in pregnancy. So looking at the statistics, it's suggested that it's not just suggested, but it's evidence-based, that about 1 in 5 women will have a mental health condition, illness. So when I talk about illness, I'm actually talking about those in the red, having depression and any of the anxiety issues and all that during and after pregnancy. And it could be someone having it in this period for the first time, or it's possible that the person had depression or some form of mental illness and were stable, but the pregnancy or postnatal period brought it on. Now, talking about the effects of maternal mental health issues is huge. It is huge and overwhelming. But oftentimes, because of lack of awareness, we all relegate it to the background. And so I've grouped the effects of the maternal mental health issues under those that affect the woman, those that affect functioning and motherhood, and those that affect the child. So studies have shown that if you have any mental health issue, it actually worsens your risk of having physical illness. So for example, if you had some form of physical illness, when I say physical, I mean some illness that affects your body. If you have any form of illness affecting your body with mental health issues, you are going to have a worsening of that illness that affects your body. And in fact, depression has been linked to having patients who are not seeking treatment in the healthcare services. So for example, they are not liver and all of that, with very bad outcomes. Studies have also shown that depression increases delivery from bleeding, for example, has been linked to mental health issues like depression. And there are quite a number that have actually had bled and had these complications after pregnancy, which actually led to maternal mortality, because it's going to impact on their health seeking. If you have those who are even suicidal, then they don't even seek the help, and it becomes too late. It also increases your risk of having a pregnancy if you are depressed. And then when you have any mental health issue, apart from it impacting you as a woman, it's definitely going to impact your husband. You will not be able to play your role as a wife. You won't be able to play your role as a mother. So that also impacts other children in the family. And so basically, your relationships are affected, your work is affected, and the impact is huge. Now, for the child that the woman is carrying, so studies have shown that if you have mental health issues, you are likely to have a very small baby. You are likely to deliver a preterm baby with all kinds of consequences. And then also, you are likely to have a child you won't feed well. And when you are not feeding a child well, so in our parts of the world, we have a lot of unintelligent children. So I'm putting it in this words, children with mild intellectual disability. So these are children who appear okay, but they are not smart. So they don't do well in school. They are always carrying the class, but they seem okay with other kinds of things. So they are not very good children. So we say these children have a mild intellectual disability. In our parts of the world, there are so many people like that. They end up dropping out of school at some stage, and sometimes even on the streets and all that. So there are so much consequences. There's a tendency that if there's a woman with maternal mental health issues, they are not likely to send their children for immunization. If the child is sick, they are not likely to seek care early. The impact is huge. And so these children are likely to have delayed development and growth issues. It is extremely important for very young children and babies to be attached to their mother, to be stimulated by their mother. And if you have a mother with any kind of a mental health problem, it affects their ability to stimulate these children. And so these children tend to have attachment issues, unmet emotional needs. And studies have shown that these children end up with much serious conditions, some of them behavior issues, challenging behavior issues, which when goes into adulthood, actually becomes criminal behavior. Now, what are some of the risk factors? So when we say risk factors, we are looking at some of the factors. There are certain factors that will make one woman more predisposed to having a mental health issue than another woman. And some of these factors are, for example, having a mental health disorder in the past. If you are a woman and you've gone through any kind of a traumatic situation, so some women are in a very abusive relationships, are going through intimate partner abuse and violence, they tend to have a higher risk of mental health issues during pregnancy and after childbirth. If your pregnancy was a challenging one, you went through a difficult labor, or you had complications, or you've had a previous miscarriage, then you also have a likelihood of having maternal mental health issues. If you have an infection like STDs and HIV, it increases your risk. So age, if you are young, you are a teenage mother, you tend to have a higher risk. And then also, if you're an elderly woman, an older woman having children, there is also a risk. If it is your first pregnancy, you have a risk. And if you have many children and you are coming with another child, there is also a risk. If you've gone through some form of a stressful life event, the risk is high. If you have low education as a mother, if you are poor, if you have poor nutrition, if you have very little social support from family, support from your partner or your spouse, it also increases your risk. If you didn't intend the pregnancy, so these days we try not to use unwanted pregnancy, but unintended pregnancy, then it's a risk. As for some people, they have had fertility difficulties before having the pregnancy. That's also put them at risk. And there are those who have had one particular gender, so they have had all male children and are looking forward to having a female. So you have 5 boys at home, and you are hoping that this pregnancy is, this child is a girl. It also puts you at risk of maternal mental health, and then also if you abuse substances. I must say that as women, our hormones play a role. So because there are changes in hormones, it actually puts us at risk of mental health issues like depression. So I must say that more women tend to have depression, premenstrual depression, perimenopausal depression, postpartum depression, just because of the hormonal changes that affects them during these periods. Now, it's not all gloomy about the maternal mental health issues, but there are factors that are protective, which we can hold on as partners or spouses, as family, as society, as a healthcare system that can help support these women going through the maternal period. So having a strong social support is protective. If you are highly educated, it's protective. If you have a good income, it's also protective. If your previous pregnancies were positive, so your birthing was positive, it's also protective. And having high quality maternal and child health services. This is really important because a lot of people complain about attitudes of healthcare staff, how they treat them, procedures they carry on them without acknowledging their concerns, how they talk to them. Some women are beaten during the birthing process and all of that. So I know